Hello and welcome to Dreamers to Doers. This is Sameer Desai, founder of Seagull Advertising. And today I have with me a doctor who not only used to practice but now is an administrator and has set up the enormously well-known health sciences and medical practices at Symbiosis. Dr. Rajiv Yeravdekar, welcome to our episode. Great to have somebody like you. And I've been fortunate to work with you in your earlier years and even in mine when we are going through a journey. So Rajiv, you've come a long way. Yeah, from a simple, I would say, short program, short courses to a full-fledged medical college at Symbiosis. Yeah. And in addition to that, you oversee and you're part of the policy making at the highest levels of Symbiosis University. So how has this journey been, Rajiv?
Yeah, first of all, Sameer, thank you for having me. As you rightly mentioned, we both have grown up together professionally. And at the outset, I would like to compliment you. I like this caption, Dreamers to Doers, because it encapsulates the journey of an individual traverses, Yeah. And as you rightly said, way back in the mid-80s, when I had recently passed out from BJ Medical College as a young medical graduate. Okay. Then I went on to do my post-graduation in obstetrics and gynecology. But I also always wanted a Western qualification.
Okay.
And a British qualification is a passport to the globe.
Okay.
But frankly speaking, I could not afford it.
Achha.
And therefore, I realized that the best way to get a British qualification is to afford one. And affordability was by increasing my income, which would not be possible in India at that point of time.
Okay.
So the best option was therefore to go to the Gulf, because Gulf was at that point of time, and probably it still continues to be a financially lucrative destination. So much against Dr. Vidya, my wife's desire, we picked up a job with the Ministry of Health, Sultanate of Oman, in the early 90s, 91 to be precise. 17th November 1991.
Oh, lovely.
And we went to Oman to do a job and at the same time give my membership examination with the Royal College of Obs and Gynae at London.
Okay.
I did my exam, fortunate enough to pass in the first attempt.
Fantastic.
And in 1996, after I had got the requisite experience, having worked in the UK and having got a reasonable pot of money, came back to India to pursue and continue with my academic journey. Okay. I was a teacher in the BJ Medical College and Sassoon Hospital in the Department of OBGY. And even after I came back from Muscat, I rejoined Sassoon Hospital again as a teacher. And then it was only in 2002 when Symbiosis got the deemed university status, 6th of April 2002, I rejoined Symbiosis again as a founder of the Faculty of Medical and Health Sciences. Today, at that time, since we didn't have a medical faculty, it is Faculty of Health Sciences.
So Rajiv, if I remember the Symbiosis of those days, extremely humble beginnings, no?
Yes, I mean, and now, still continues to be.
The beginnings are no longer humble. The founders are humble.
Yes.
Yeah, I think if I get that right.
Okay.
Yeah, I mean, I know, I've seen Dr. Mazumdar, I've met Dr. Vidya.
Your family.
Yeah, very, very humble at all points in time. Always remember people who have been with you and continue to be with you.
Yes.
So just to ask you, when you started health sciences, used to do even smaller programs like fitness training and wellness and fitness instructors. Very, which now seems that you have a full-fledged course, was very small. But even those days, these were pioneering programs. I realized gyms were coming up.
Yes.
And the problems you were trying to address was the lack of trained instructors, which I remember you telling me that an instructor who's not trained causes more damage,
of course,
than help.
Yeah.
Right? And you spotted this and you created a program for this.
Yes.
Yeah. So what motivated you that time for even something as small as that?
See, when we came back from Muscat, we wanted to replicate the public healthcare delivery system in Oman back in India. Lofty youngsters, lofty dreams, lofty idols, and
you've lived up to all of them. Right?
Yes. In that sense, at that point of time, we wanted to do big. But then when we came back to India, we realized that we can't do the world the good. Okay. So we said we will try to do it in a small community as a pilot at Symbiosis. But despite Dr. Mazumdar being my father-in-law, he said you would have to go through the rigmarole of presenting it to the managing committee. Your dad was that time a member of the managing committee, and he said it has to get a consensus mass appeal.
Correct.
And therefore we made a presentation to the then managing committee, and even one of the managing committee members had probably the foresight of asking us that are you committed to this project of setting up a health center on campus?
Correct.
Because what if you go back to your foreign destination and you leave Symbiosis in the lurch, high and dry, because we have no footprint at that point of time. Symbiosis had no footprint in the healthcare sector.
Correct.
And we gave him an assurance, and I'm glad we have lived up to that commitment. And therefore, we started off with the health center on campus, trying to replicate whatever we had learned in Oman, and to make it in a way financially and functionally viable, we did small odd jobs. So we did training programs, we did something in the services part for us to be known. So at that point of time, there was this magazine Citadel, and I believe it still is on. We used to write a large number of articles in Citadel, in Pune Times, in Pune Newsline. That time the edition of Indian Express was called Pune Newsline. It still is, I believe. And we used to do a lot of community activities, inter-school health essay competitions, intercollegiate health quiz competitions, first aid for people who are on the pool side, because there were a large number of pool deaths at that point of time which had happened. And then, as you rightly mentioned, we started this program in fitness training, because I realized that many a times the gyms were unattended.
Correct.
And the instructor did not know the basic anatomy, basic medicine which he or she should be knowing, and God forbid, in the unfortunate event of a medical catastrophe, did not know even the first aid.
Correct.
Another thing which came to my mind was that children going to schools, especially schools which are early morning, would miss out on their breakfast. And at the end of the day, at 2 o'clock, they used to go home ravenously hungry. Or the second scenario was the mothers used to pack pre-night food or the leftovers of the hotel which they had visited the evening prior and give it as a food. And most often it used to be unhealthy, fast food, fried stuff, or savories from the bakery. Easy to get,
Correct.
And that was increasing the incidence of childhood obesity.
Okay.
And that caught my attention. And therefore, in our school at Symbiosis, way back in 1998, we set up the midday meal program.
Oh, fantastic.
We connected with the pediatricians. We said, tell us how much a child should eat at that point of the time. And therefore,
we created that. Huh?
We created the midday meal. Then we also realized that technology had just begun to invade into every aspect of our life. And practicing doctors did not have the time, energies to upgrade themselves professionally, because they always had the reason, I've got a fantastic practice, I don't have time, energies. By the time I finish my clinic, can't attend a full-time program. We got into distance education at that point of time.
Yes.
And we started programs in non-conventional areas. For example, medical legal systems, hospital and healthcare management, clinical research, to give basic insights to the practicing doctor as to what impacts his practice.
So what I can say, Rajiv, at that time, of course, Symbiosis didn't have a full-fledged medical college.
No.
It was a long way, and I'm sure you'll talk about it as to how you went in that direction.
Yeah.
But that was always a dream, right?
Yeah.
When you came in also that you will have be a part of a medical college or create one if the chance is. But I remember these programs that you do, which seemed like the hospital and healthcare management. Hospitals were not even in that sense as professional at that time. What you see now.
Yeah.
But you still had the vision.
Yes.
And this may be because of your Gulf experience, that there could be better ways to manage a hospital. And I remember this. There's also one more very interesting program you did.
Yes.
And which was the emergency medical services.
Yes.
Yeah, the EMS program.
Yes.
And you started training people in that golden period, right? When somebody can be saved.
Absolutely.
And you did a lot of work in that direction.
Yeah. This was way back in, I'm glad that you remember, 2002, and that time 2 nurses had come down, Kathleen Chidester and Jacqueline Benedict. I remember these 2 nurses who had come from Los Angeles Paramedic Training Institute, the oldest medical paramedic training institute in the world.
Fantastic.
It's in Los Angeles. And they came down, and one Professor Bala Subramaniam, who was an Indian NRI, who was based at that time, and they came down and impressed upon us the need for starting emergency medical services, learning from their journey back in the US.
Correct.
And what happens typically, and it still holds true, we doctors are tigers in well-equipped hospitals with the best of nurses, best of equipment. But in our formal training program, and it's just being recently introduced, we're not taught pre-hospital care. What to do before a patient reaches the safe confines of a hospital.
Okay.
So what all first aid, what all is to be done, and more important, what is not to be done. So, for example, not moving the spine, the neck of a person suspected of having a head injury is basic. Or not to give anything by mouth to a person who is semi-conscious was not taught and emphasized the way it should be. So we thought of training these doctors, and saving life is not the prerogative of any pathy. You don't require a homeopathy or allopathy to be fiefdoms of patient care. Sympathy should be the fiefdom of patient care. Okay. So we said we'll take the non-allopaths also, and at that point of time we did get a lot of flack, a lot of criticism
because of getting these people who are
yes,
not.
Yes, is it promoting cross-pathy? And that time we fought tooth and nail, and we said we are teaching emergency medical services.
Correct.
We are not teaching emergency medicine, which is a scheduled subject in the.
It is that moment, right? That's those 7 minutes, if I'm correct, is what you call that time.
You have to save the life of the patient.
Correct.
So if you want to thump someone's chest, or you want to give mouth to mouth, abroad even a 8th grader can do it. So why must we insist that a allopathic doctor, pure gold, 100 carat, should be the one?
If I remember that time also, Rajiv, we should do a number of these programs also, right? A half-day program or a full-day program, training corporates, training in companies, so that their people can be those first responders.
We've done ambulance rides. We have done helmet rallies promoting the use of helmets among students, because we found a lot of students ended tragically their lives simply because they did not use helmets.
So Rajiv, in a manner, if I could understand, now of course after Prime Minister Modi, huge emphasis on skill-based education.
Yeah.
But what you were really doing in those early 2000s was skill-based or enhanced skills.
Yes.
Right?
Yes.
And making sure that those
life-saving skills,
those professionals were available.
Yes.
And even right as simple as we started with the fitness instructors.
Correct.
And even I remember that time when gyms
medical technologists.
Even when gyms were coming up, if I remember, they didn't have trained people to run those gyms.
Absolutely.
And used to run a managerial program.
Yes.
For
postgraduate diploma in fitness management.
So
teach them the science of
fitness
and
how to run
it profitably, ethically, morally. We also represented to the Pune Corporation that today, what licenses are required to set up a gym? You require a shop act license, that's it.
So Rajiv, just to come before we come to the medical college, now these great innovations, even today I'm very excited to hear of them.
Yeah.
Okay, when you talk about this EMS, when you talk about fitness instructors or fitness managers, or hospital management, okay, which is done, so they understand both the nuances of healthcare, medicine, as well as how to run the entire setup. Right? Are they still operational within the Symbiosis Health Sciences?
The postgraduate diploma in emergency medical services celebrates its 50th intake.
Oh, fantastic!
Next year, so we're going to 100. Sorry. So we take a biannual intake. So we'll be having a celebration next year. The postgraduate diploma in fitness management has now got converted into full-fledged Symbiosis School of Sports Sciences. Fantastic. So it offers an MBA in sports management, a BSc in exercise and sports sciences. Because see, now that we have come under the tutelage of a university, you have to use the academic lingo.
So tell me, why are you not? It's just a thought which comes to my mind, because you have gyms across left, right, and center. Everybody now, I think, is more aware. Generally speaking, more aware, or maybe probably you and me are more aware about health, what we eat.
No, awareness is right.
Yeah, but why are the gyms not being certified by the government? Why is there no program to make sure that they are equipped? Like, you can't practice medicine
without a license.
If you're not a certified doctor.
Yes.
How can you practice a gym every society now, every residential place has
a gym or some sort of
but it's being run randomly.
Yes, there is no regulation on this, and all what I could say probably is a unfortunate lack of political will.
Okay.
And I had a couple of years ago also recommended to the then Minister for Civil Aviation that at every airport one reaches at least about 2 hours early.
Correct. Oh, you could have a...
There are swimming, designated areas of swimming. There is a spa which gives you massage. If I'm a fellow who's committed to my well-being, fitness, why can't you have a dedicated area for
what I feel like? So I'm going to be a little bit critical. I never do this, but I'm going to do this. But I think because of your role as an administrator, policy maker, and as an academician, okay, I think you've been on the, if I would say, on the giving side,
offering side
of business, if I can use the word business.
Yes.
Not really from the taking side.
Yeah.
But if Symbiosis is on the taking side, I wouldn't be surprised if I could see Symbiosis gyms all over the place. I wouldn't be surprised if I saw Symbiosis wellness centers at airports, because these are business ideas.
Yes.
But probably because you're on the giving side, the offering side, to do these lack that business mindset. That's what I think.
Well, to answer your question, we are in the business of education.
Correct. Not
so
in the
I will do it for my community, on which whom I'm committed to a relationship by way of a student-teacher relationship.
Correct.
So we have recreation and wellness centers. Again, the lingo has gone changed. So we move from a paradigm of health to fitness to well-being to recreation and well-being. So our fitness centers are no longer called fitness centers. They are called recreation and wellness centers. So because you've got the gym on one side, you've got the yoga on one side, you've got outdoor sports, and you've got indoor sports.
But these are in your academic institutions only.
Yeah.
You will not put this up at the Pune airport or the Mumbai airport.
No, because that's not my mandate.
That's not your mandate. Your mandate is to educate and hopefully some of your students.
And give this as value-add services to my captive audience, which is my students and faculty. And to a certain extent, the community around it. So we have got open-air gym in our hospital premises, where every patient's relatives is informed that there's a community gym niche.
Achha, and they are welcome.
It's called Sim Gym.
Sim Gym, okay.
It's open to the community, because with one patient, there are 10 relatives who are coming.
Correct.
Who are doing sweet nothing.
Correct. And they can utilize this time.
Utilize your time. When the patient is gone for an MRI, you're going to sit waiting 2 hours outside. Go and work out.
So I just want to ask you, again, I'm just developing on the spot. Is, from what I'm seeing, the whole recreation and wellness is a need of India, or probably the need of the world.
Absolutely.
Definitely in India, there's a huge need.
Yeah.
There are, like I spoke to, real estate developers who are setting up the infrastructure, probably some of the best, but it's not being operated, not being run. Can probably Symbiosis, health, medical sciences under this have entrepreneurs who come out, who can run these places?
Entrepreneurship is one of the models of these training programs. And in fact, in our hospital, we are exploring the possibility of outsourcing some of these services, because from a business point of view, they probably might do better.
No, they will, because there's a big need.
Yes.
And it's just, it's lying vacant. Yeah. And it's very fashionable to say that India is the capital, the disease capital for X, Y, Z.
Diabetes.
Yeah,
we are the diabetes capital of the world.
But we, as for example, you have the skills. Symbiosis is known for its management and entrepreneurial skills. You have the medical and health sciences over the last 25 years built in.
Yes, and management antedates that to 78.
To 78. So the whole process is there.
It's finance management, whether you manage it healthcare, whether you manage economics or IT or anything.
So that's a great opportunity, I think. Yes. And I hope to see in the future that many of the private the fitness, healthcare, recreational setups are managed by Symbiosis entrepreneurs.
One word I learned in Muscat, Oman is Inshallah.
Inshallah. Okay,
so God willing, it will happen.
Okay. I want to move on to your women focus and in terms of helping women, do better, both in terms of health, profession, etc. And the medical college that you recently have set up is 100% women-oriented medical college.
Yeah.
And you also run now a podcast on women well-being and empowerment.
Yeah.
Right? So what is that and why that particular focus?
So it started off my assessment of this need for women in the healthcare. So we analyzed that when it comes to the performance in the National Eligibility Cum Entrance Test, NEET, which gets admission to a medical college, girls, as in other academic streams, do better than boys. So
smarter than the boys, huh?
Okay. Well, admitted, yes. As the more disadvantaged species of the Homo sapiens, I have to admit it, that they do say about 51 odd percentage girls qualify, 49% boys would qualify. But fast forward 5-10 years, less than 17%, less than 17% of the women reflow back into the healthcare by way of practice. For various reasons, we need not get into those factors, but predominantly their family responsibilities, family rearing, male-dominated patriarchal society, the reluctance of parents to invest in women's education further, maybe other reasons. So we thought that there needs to be something to be done to get more girls, more the input, more would be possibly the output. So reserve more seats for girls, do a dedicated medical school for girls, And that's how the Symbiosis Medical College for Women came. And probably it was an intuition to Dr. Muzumdar when he happened to see this movie, Anandibai Gopal Joshi, which talks about the story of the first Indian woman doctor who went up in the 1880s to Pennsylvania to learn medicine, wanted to come back and practice medicine. She is credited to be the first woman doctor from India. But unfortunately, she succumbed to tuberculosis and she could not do it. But that movie probably ignited a spark in him, and he told Vidya and me, we need to start a medical school, and we were on the platform springboard, accepted it, and rest is history, so as to say.
So what you really expect is, as a result of this, more women doctors.
Yes.
And obviously you're hoping that many of these will continue practicing. And contribute to
contribute to the development of the healthcare, teaching, training, research, services. And every lady is a born gynecologist.
Correct. So Rajiv, if I look at your career, stellar academics, done your MD, you've done very well. Then
I did my PhD thereafter.
You did your
Pune University to learn more of management from guys like you.
No. We are learning from you, know that better. So academics has of course been very easy for you in that manner, if I can say.
It's my passion.
It's your passion. Lovely. And then you were in Oman, you practiced. So prior to that you were teaching in Pune in the BJ and Sassoon Hospital. And then you went to Oman, you worked there, you practiced there. You came back here again in practice.
Joined Sassoon. I was never into private practice as such. Private practice has never been my forte. So I was always into academics. So I joined Symbiosis again into the academic fraternity.
And you're close to 30 years now in Symbiosis, correct?
Yes.
Close to 30, in which massive progress from smaller from smaller programs, if I can say, diploma certifications, to healthcare facilities for every student. If I'm correct, every student in any Symbiosis campus is covered up by the Symbiosis Center of Healthcare. So you're doing a massive process out there. And now the medical school. Besides your other responsibilities in policy making and administration for Symbiosis. So a lot of learning. So we have youngsters who watch this program.
I'm glad.
And it seems when you talk Symbiosis now, it's such a large thing. People are enamored by it. But they'd like to know from you, what have you been, because I think through this entire conversation, I really didn't see any challenges or obstacles.
I wish you were true.
The smiling Rajiv doesn't show anything like that.
I mean, one always faces challenges, and there were constraints. There were at times when I felt like giving up.
Really?
To be frank,
Give me one such instance, if you'd like to share.
The transition from a clinician, and I was very happy doing my surgeries and patient counseling in Sassoon Hospital. I was never into private practice. It's not to be misconstrued that I was not into patient care. I always worked like teaching in a hospital coupled with patient care rather than the commercial private practice. So I missed for a long time, for close to about a decade.
You missed actually working with students or patients, is that?
Yes. So for a decade and a half after I left Sassoon, I used to miss my Monday morning 8 o'clock where I used to start my surgery. For 15 years almost, Monday morning 8 o'clock was my incision time. I missed my antenatal counseling OPDs. I missed my medical termination of pregnancy clinics where a lot of counseling goes. So for about 10-15 years, I really missed that because it was a transition from patient care to academics. And coincidentally, my branch is so live wire. Had it been not so active branch, obstetrics is you have to be there at that minute. That second.
Anything can happen.
Anything happens. It's as they say, obstetrics is a bloody business. And we've seen women bleed to death in few minutes. So I thought I was not doing justice to patient care or my new role as an administrator, policy maker. So I had to really give up my academic career and my patient care delivery role in Sassoon Hospital. And for a long period of time, that haunted me.
So making a choice is one of the most difficult.
The transition and no looking back thereafter. Because if you keep on looking back, I should have done that, I could have done that, then you're neither here nor there.
So what's your advice to people who are watching this and if they want to get out on a career, do something of their own? What do you have to say to them?
So if you have the passion, you dream of something, get obsessed by it. And that then have the conviction that you can do it and do it. One is never postpone things, because if you are going to do things tomorrow and day after, there's someone else who will do it today. And you need to get the pioneering advantage. That's one thing. And as long as you can get a good night's sleep, if you are convinced that what you're doing is
right,
legal,
okay, ethical,
moral, Roger, go for it.
You've seen so much happen.
Yeah.
Right? In your Symbiosis journey.
Yeah.
What was that one moment which got tears of joy in your eyes? I said, wow.
At Symbiosis?
Yeah.
The establishment of the medical school and the hospital is indeed a watershed event. Okay. Because today in the healthcare world, it's medical education and the hospital which is at the pinnacle and the apex.
So if you have medical education and hospital means
you're
somebody.
You're somebody.
Okay.
And then you can have the peripheral institutions. We went about it in a reverse way, setting up the other institutions. We went from the base of the pyramid to the apex.
So how many years did it take you from the time you thought you would have a medical college till a medical college actually happened?
Well,
did you come in from Oman thinking there'll be
No.
So when did that dream, when did that seed came? Asa ek divshi hu shakta?
We were dreaming about it that one day we'll have to set up a medical school, because all these other institutions, no disrespect meant, they are important. Programs in public health, healthcare management, medical technology, biological sciences, all are there important. But the nucleus and the fulcrum is medical school and the hospital. So from 2011 to 2015, there was a conscious decision that we will not set up a medical school, because I was on the board of governors of the Medical Council of India.
Achha, okay.
And I didn't want any conflict of interest of office. And there were other reasons, that's why we did not set up the med school. The day I left, we started thinking about it, and I must give the credit to Dr. Muzumdar to spearhead this. I mean, probably the spark came after he saw the movie, got convinced that the medical school is the need of the hour, and we were more than happy with that, me to toe his line.
Once he decides something, he does it.
Oh, yeah. And we are happy to jump on the bandwagon. Fantastic. Because that was our backyard. Now, Vidya has moved from medical to higher education, but I am still firmly grounded onto healthcare, and I'm a hardcore healthcare professional at heart and at action. Okay. So, it was getting back on our home turf, so to say.
Fantastic, Rajiv. So, Rajiv, thank you so much for being on this podcast. It's very enjoyable. One would normally think that a doctor is a very serious person.
No.
Yeah,
life is too small to be too serious.
I think you've really shaped a wonderful career from being an academician to a practitioner, coming back to being an academician, and now actually somebody who's setting up medical schools, many specialized programs. Really a privilege. And I think I know why you sleep well at night.
Yeah.
Because you've done a good, ethical, moral job for yourself and for the city and for the country at large. Thank you so much.
Thanks a lot. Thanks, Sameer. Pleasure having you.
Thanks, same here.
Pleasure interacting. Thank you.
So this was a lovely conversation with Dr. Rajiv Yeravdekar of Symbiosis. Like always, see you next time on the next episode of Dreamers to Doers.